Chapter 29, Health Information Technology Governance. The general principles and recommendations provided should be equally applicable to other healthcare settings, like small and medium-sized healthcare organizations and post-acute facilities. Given that healthcare is an information-intensive endeavor, Health IT represents a core pillar that enables and supports a modern healthcare organization's ability to achieve its strategic and operational objectives. Health IT encompasses virtually all aspects of a healthcare organization's clinical and business activities, which include clinical care delivery, billing, human resource management, staffing, financial management, population health management, research, education, and the tracking and improvement of care value. The critical nature of effective health IT governance then arises from the following fundamental interrelated needs. The need to ensure alignment of health IT resources with institutional priorities, and the need to effectively prioritize the use of health IT resources in the face of numerous competing demands for these very limited resources. The role of health IT governance is to help clarify priorities, allocate resources, and, when and if necessary, approve the funding to support the expansion of available health IT resources. When establishing a health IT governance, strong consideration and respect should be given to the governance structures and the decision-making processes that are already in place within the organization. It is vital that strong alignment be demonstrated between the initiatives of the broader organization and the focus of the health IT program. The increasing sophistication of the IT environment has enabled both clinical and administrative leaders to leverage data in support of their programs and services. This also increasing the expectations that leaders have on their colleagues in IT. Patients and families have new expectations in terms of access and transparency of the data from their caregivers, with the expectations of patients, families, and other healthcare consumers often exceeding that of the healthcare providers and institutions. The era of meaningful use and health reform has brought regulatory mandates and incentives and new market pressures to the forefront. As the demands rapidly outstrip the internal capacity to meet the need, the prioritization of projects becomes imperative. This is the role of governance. A continual increase is evident in the demand for health IT resources by providers and administrators who increasingly see health IT as a key tool for achieving their goals. Health IT governance should be independent of any particular technology choice made. Instead, health IT governance should guide those types of technologies and the technology choices. It is imperative that the governance structure have mechanisms in place to obtain the perspectives of all the relevant stakeholders and make decisions in a manner that fosters stakeholder buy-in and sustained support for these oftentimes long-term health IT investment decisions. Health IT initiatives require the close coordination and collaboration of various institutional stakeholders. A traditional governance structure that is informatics-centered by nature, may present a barrier to the kind of integrated cross-stakeholder coordination and collaboration that is required. One of the greatest challenges for organizations that address IT health governance is deciding where to begin. A good starting point in developing a health IT governance model is obtaining an understanding of the current health IT structure and culture. Informatics Capability Maturity Model. This is a qualitative model that assesses an organization's capabilities with respect to 5 dimensions that are measured on a scale of 1, which is basic, to 5, which is innovative. Upon completing this baseline assessment, an organization should be able to identify the current maturity of its health IT governance and how improvements in that governance could advance the organization's ability to achieve its strategic objectives. Key questions to consider when investigating other organizations' health IT governance include the following. How mature is the health IT capability at the organization? What are the potential implications to governance if an organization has a significantly different health IT capacity? What is the official governance structure and process? Are there additional governance processes in place? What works well with the governance and what could be improved? Are there aspects of the governance that are dependent on unique characteristics of the organization, like its culture or specific individuals? Following the baseline assessment of current health IT governance and the evaluation of the benefits and limitations of the governance models that are in place at peer institutions, the findings should then be synthesized, and a small number of candidate governance approaches should be generated for consideration by the senior leaders and other informatics stakeholders. When sufficient institutional consensus has been attained, the new health IT governance model should then be implemented.